Earlier, I spoke to the Health Minister, Edwin Poots, in our Stormont studio. I asked him how the extra £30 million for the health service would be spent.
Well, we are spending money on ensuring that we can provide the consistent level of care that people are actually seeking. And indeed, we're also having to spend additional money this year on care for vulnerable children. As a consequence of the Savile affair last year and other BBC personalities, it has become a very public issue, and the result of that has been that we've had many more children at risk reported to us, Minister, and that's costing us around £5 million.
Minister, you asked for 65 million. You got less than half of that. What difference is this going to make to frontline services?
Well, there's a saying that half a loaf's better than none. We will be dedicating this towards frontline services. There was an element of that request was for clinical negligence, which deals with cases that happened many years ago where there was failings, and the courts are now dealing with those more quickly. As a consequence, we will be paying out around £56 million on historic cases this year. In terms of the money that is being spent, that'll be for the trusts. They have identified a number of areas where they needed funding to see them through to the end of this year, and I greatly appreciate the support that the Finance Minister has given me to ensure that we can support the trusts in that way.
There's a huge figure there that you have mentioned on clinical negligence. That can't please you.
No, and the courts are dealing with these things much more quickly. And therefore the bill that we might have anticipated has risen by over £20 million this year. So these are genuinely unforeseen circumstances that we're bidding for, and consequently Simon Hamilton is taking the right decision in supporting us to ensure that other healthcare isn't compromised as a result of Minister, having to pay these bills.
This money is going to have to come from somewhere within the department. Is it likely that it could come out of frontline services like A&E at the Royal?
No, we have our priorities, and
but you've got to find the money from somewhere.
Providing care at the hospital door will remain a priority, and ensuring that people are seen in a timely way, and setting aside the timing, that they are provided a quality of care when they go to these facilities.
Minister,
so people who have heart attacks and strokes will have a better chance of survival now in 2014 than they would have had previously.
Can I ask you, how have things improved at the Royal since 2 weeks ago when a major emergency had to be declared?
Well, we faced in the Royal over a course of 3-4 days a much higher number of admissions than normal. We normally admit around 70 to 80 people, and one of those days we admitted 127 people, and we admitted over 100 each day. Consequently, there was a problem arose. That problem was dealt with at that time, and we are working our way through our emergency departments as usual. They're very busy places at this time of the year.
Minister, can I just ask you,
people are working under immense pressure.
Are you happy then with the situation as it stands now at the emergency department at the Royal?
I recognise that our emergency departments are always under pressure. The staff are hugely busy, and this is exacerbated during the winter pressures, and January is a month of those winter pressures.
It's not really been that cold.
It's got nothing to do with cold, with respect. People tend to be more run down in the winter period, and we always get winter pressures, especially in around January, and usually again in March. So our hospital staff are working manfully through all of the issues that are coming their way. They're saving lives, they're doing sterling work,
Minister,
and we as a society should thank and congratulate them for that.
Minister, while I have you in the studio, I cannot not ask you about Ian Paisley and the programme last night. Did Mr Paisley become a liability to the party?
Ian Paisley is a man who's held in the highest regard by people within the DUP.
But that's not the way it came across on television last night. That's not the way he sees it.
He served the party faithfully for 40 years, and we're indebted to him for the work that he's carried out over that time.
Minister, did the DUP want rid of him?
Ian Paisley has served us extremely well over a very long period of time, and I hold him in the highest regard possible. and I have the greatest respect for him and wish him very well.
He thinks the party did want to get rid of him. Do you now believe that the party is in some way damaged by that revelation?
I think that we need to concentrate on the service that Ian Paisley provided for the public in Northern Ireland. And he was someone who always stated that he wanted to serve all of the community. He done that in his constituency day and daily. He led us to a situation where Northern Ireland is in a considerably better place than it was whenever I was growing up.
Why then
as I say, he's held in the highest regard by myself and my colleagues.
Why then does he believe he was shafted by the party?
Well, Ian Paisley is someone who I have the highest regard for. He's a person that I respect greatly, and you can ask me as many times as you like, in as many ways as you like. That's something that I don't deviate from. He's a man who I hold in high esteem and look up to him for the service that he's provided for the people of Northern Ireland.
Edwin Poots, I hear what you're saying. Thank you very much.
Thank you.